By using AI, this team provides physicians with the capability to better assess and quantify patient pain levels to enhance their treatment plans. Ladies and gentlemen, please welcome Philip Daffis from PainChek.
Good morning, everybody. At PainChek, our purpose is to give a voice to people who cannot verbalize their pain. Pain assessment is difficult. It's especially difficult for those people living with dementia and cognitive impairment who are unable to verbalize their pain and report their self-pain. It's also very difficult for the young children, the pre-verbal children, who haven't got those communication skills so far. For these patient groups, pain is often undetected and it's undertreated. And the worst case scenario, it's mistreated. The market opportunity here is significant. There are 400 million pre-verbal children in the world at any one time. There are 50 million people in the world with dementia, and that's increasing to 75 million by 2025. If I focus on the dementia issue, if you look at hospitals today, the epidemic of dementia is resulting in that more than 1/3 of hospital beds are occupied with dementia patients at any one time. From a cost perspective, dementia patients typically stay 18 days longer in hospital than the average patient. The risk of delirium is threefold greater if their pain isn't managed effectively. And finally, that they receive more than 50% of them receive antipsychotic drugs. And one of the reasons here, from our research and our work in Australia, is that one of the problems nurses and doctors have, if they're not assessing pain properly, they look at the behaviors of people with dementia and think it's been driven by the disease. And often it's an underlying cause of pain. If we can get better pain assessment for these patients, we'll reduce the amount of antipsychotics, we will reduce the risk of delirium, and we believe we can reduce the hospital stay. 3 very worthwhile projects. There are tools to assess pain, and these are all validated tools, and they're all in hospital protocols. But the problem is they're manual, they're paper-based, they're highly subjective, therefore risk of errors, and they're underutilized. The other factor for these tools is that you need really specialist nursing education. And for what you heard on the video earlier, that's difficult to do in a busy environment today. So let's enter PainChek. PainChek's designed to be used by any carer, any nurse, any carer in the hospital environment or aged care environment, and in the home environment as well. What we have done is we've intelligently automated the whole pain assessment process, and we brought in artificial intelligence to assess the most complex part of the process, which is the facial assessment. We use AI and a short video assessment in real time to assess the 9 microfacial features of pain, and we document it for the carer. The whole assessment process is rapid, it's documented, and is fed through our API system into clinical informatics to provide better care management going forwards. The project started in 2012. After 5 years of R&D and clinical assessments, we've made our first product to market, and we've got CE mark and TGA clearance. In the last 2 years, we've focused on Australia, our core market, to build the business model and establish the product. Today, we have more than 250 facilities using the technology. We have more than 30,000 patient beds covered, and 80,000 clinical assessments conducted over that 2-year period. We have proven the product, the business model, and we've shown that people will use this over and over again. In fact, it's so successful that the Australian government just awarded us a $5 million grant to roll this out to 100,000 people living with dementia across aged care. Now, for the past 12 weeks, we really appreciate the fact we've been working with the Philips team to pull together opportunities, and we see a sea of opportunities. But for right now, we want to focus on 3 areas. The first area is to bring our PainChek app, our validated, regulated PainChek app, into the Guardian mobile platforms. Therefore, bringing pain assessments to the general care environment that can be automated, documented, and improving workflow. It can also be another vital sign in your approach to get early warning systems and prevent those alarms happening. Mixing vital signs with pain could be significant. The second area we want to focus on is more midterm, and that is looking to work with your camera-based technologies such as the Vital's Eye and Vital Minds. And by doing that, we can add the pain assessment, but also add the ability to prevent the risk of a delirium. And the final C is for children. Our children's app has now been validated at Melbourne Children's Hospital in Australia. We expect to be ready by 2021 for the market, and that's a significant market. We believe you've got hospital opportunities and mother and childcare opportunities. We've spoken to your mother and childcare group, and they're very keen to work with us right now to prepare this for 2021 launch into the home care settings. So my final message is, we really look forward to, and we really ask for Philips to join us in this journey to help give a voice to those people who can't verbalize their pain. Thank you.